Hi everyone, it's Janet from PUL Tool. I'm going to share with you the 3 must-follow tips for wearing and caring for your clear aligners. There are many times when I would give our patients their aligner care instructions, and 90% of the time they'd forget everything that I tell them. So this video is for those patients who've had those goldfish moments, or for those of you who want to prepare yourself before you begin treatment. In this video, we'll cover these 3 topics: how to put on and take off your aligners, how to clean your clear aligners, and how to care for your aligners, plus some bonus tips at the end. Each set of aligners comes with 2 trays, one for your upper and one for your lower set of teeth. To put on your top aligners, make sure you have your top set before starting. They are usually the larger of the aligner set, with the front 2 teeth being the largest. Line the upper aligner with your upper teeth and then press them into place. To put on your lower aligners, make sure you have your bottom set before starting. They are usually the smaller of the aligner set, with the bottom 4 teeth being about the same size. Line the bottom aligner with your bottom teeth and then press them into place. You'll most likely notice a gap between your teeth and the aligner. It's normal for the first few days in each new set of aligners. However, that gap should be fully closed before you move on to your next set. A closed gap is an indication that your teeth has shifted fully into place and that you're ready for your next tray. Use an aligner seating device like the Bite Me to help push your aligners fully into place. Use the Bite Me for 2 to 3 minutes after each time you put your aligners back in, or for a total of 10 minutes per day to help shift your teeth into place. Removing your aligners at the beginning of each new tray can be a little tricky. And then you mix in attachments, buttons, or rubber bands, and it makes it even more difficult. It's because your teeth has not fully shifted into place just yet. But don't worry, because as you progress through that aligner, and now you're on day 5 or 6, it'll become so much easier to remove. Many patients can use their fingernails for aligner removal. To do this, I recommend removing your aligners towards the posterior or your molars and on the lingual or your tongue side. You want to start on one side and then the other and remove gently. Do the same with your opposite set. A warning that I give all of our patients is to not rip your aligners out of your mouth. Like, don't just rip it out. The reason why is because it can damage your aligners, it can warp them, and it's just something that you don't want to deal with. If you find that you have soft nails, long nails, or a lack of dexterity, you might notice that aligner removal can be somewhat more difficult for you. I saw our patients struggle with this every single day just because we had so many aligner patients and they had different hand abilities. There's nothing out there at the time, which is why I developed the original PUL tool to help those patients with their struggles of removing their aligners. Using the Bite Me or PUL tool, start towards the posterior or the molars, and on the lingual or tongue side, hook the tip onto one side of your aligner tray and gently pull down. For your bottom aligner trays, you want to hook again towards the back of your mouth on the tongue side and gently hook your aligner and pull upwards. Cleaning your aligners daily is important because our saliva is super sticky and can sometimes be smelly, especially after a delicious meal. Cleaning them daily will help with preventing buildup and keep them tasting fresh. Try to rinse your aligners after each removal and keep them safe in your aligner case. I know this isn't doable, especially if there isn't a restroom around, but do your best because these aligners can get yucky really quick. Brush your aligners with a toothbrush and toothpaste at least once a day. On days when you can't rinse your aligners after aligner removal, I recommend soaking them in an aligner cleansing solution such as our Fizz Me, for at least 10 minutes a day or while you're having your last meal to remove any buildup. It is important to care for your aligners properly to ensure they last the duration of your treatment. Here are some extra tips for caring for your aligners. Do not chew gum, even if they're sugar-free, with your aligners in. But sugar-free mints are okay. Do not expose your aligners to extreme temperatures, such as heat, being near a fireplace, or the sun. It can literally melt your aligners. And this last tip, I will leave it to your discretion. Avoid yellow mustard or curries. These tend to stain aligner trays, and it's impossible to remove. So patients who accidentally eat mustard or just can't resist the curries, because I definitely will always pick curry, will walk around with yellow stained trays for however much longer they're in that set of trays. Wear your aligners for 20 to 22 hours a day. It is so important for you to wear your aligners for this long, and the success of your treatment is dependent on how long and how often you wear your aligners. I always tell our patients that aligners only work if you wear them. My office highly recommended that patients do not eat with your aligners in. But if you have to, be very careful with what you're eating and drinking while you have your aligner trays in. Avoid sticky foods, sugary foods, or any foods that can stain your teeth. Also, avoid very hot beverages as they can warp your aligners. Brush and floss your teeth before putting your aligners back in after every meal. This will help prevent cavities and gum disease. And lastly, if you have any problems with your aligners, such as discomfort or extreme pain, contact your dentist or orthodontist immediately. I hope this video gave you a basic understanding of wearing and caring for your aligners. If you'd like a more comprehensive overview for your clear aligner treatment, check out our top 10 rules of Invisalign video. If you found this video to be helpful, please hit the like and subscribe button and share with your friends. Happy pulling!